Hello everyone, my name is Amanda Parker and I am a provider here at HighPoint Health. I am talking to you today about childbirth education. This will be split up into a 4-part series. Part 1 is all about the discomforts of pregnancy, what's normal, what's not normal, things that you should report to your provider. It'll also touch on the factors that can influence the length of your labor. That second part, we will talk about all about that labor, including the delivery process. We'll talk about the stages of labor, pain management and epidurals, and we'll also talk about natural labor. The third part will go over cesarean sections and postpartum care. That fourth part will focus on newborn care and breastfeeding. So let's get started with part 1. Here at HighPoint Health Birthing Center, we have 7 different labor, delivery, recovery, and postpartum rooms. What this means is the labor room that you are admitted to will be where you have your baby and also where you'll recover and spend your postpartum days here with us at the hospital. We have 3 different antepartum rooms, and this is where we may put someone if they're not quite ready to have their baby, but they need to stay with us for a little bit. We have 2 triage beds, which is where we would put someone if we weren't quite sure that they were in labor and they need to be evaluated first before being taken to their labor room. Like many hospitals, we do not have a newborn well nursery, and this basically means because we believe in rooming in. Rooming is a process of when you have your baby stays with you. We have 4 different providers that deliver at this hospital, and we rotate our call, so that way someone is on call 24 hours a day, 7 days a week. In an actual childbirth education class, one of the pieces of that is a tour. So I did want to put in this photo here. It shows the labor and delivery room. It also kind of highlights that chair over in the corner, and that folds down to a bed, and that's for your support person. You see the monitoring equipment there on the right side of the bed, and you also see that there's a fridge there so you can put drinks and snacks in there if that's something that you want to do. I get this question a lot, so what should I bring to the hospital? For you, if you're breastfeeding, you'll want to pack a nursing bra or nursing tank tops. If you're bottle feeding, you'll definitely want to pack a couple of sports bras. You'll want to bring clothes for going home, and some people actually change into those clothes after they have their baby. You can stay in the hospital gowns, but most people prefer to be in their own things. I definitely recommend bringing slippers or sandals, something that's easy for you to walk around in. I also think you should bring toiletries for both you and your partner, because that first shower after delivery is the best, and you'll want to kind of be like yourself with all of your own things. Some people find it's more comfortable for them to bring a pillow, and you can absolutely bring that along. And definitely pack phone chargers. Those are the #1 things that are forgotten. For the baby will need an outfit to wear home. We'll need blankets. You'll also want to pack a baby book if that's something that you have. If you prefer a particular brand of pacifiers, we ask that you pack those with you. And also you'll need a car seat. The base should stay attached in the car, and you can bring in the carrier with you. So let's get started on the discomforts of pregnancy. We're going to talk about what's normal. And the #1 complaint of pregnancy is back pain. And I want you to take a picture and look at it here. This right here, you see how the back curves like that? That really illustrates what the back does in pregnancy. You see all of this weight being in the forward part and all of that pressure being in the back. In addition, on this photo, you can see the stomach is kind of pushed up more into the diaphragm. So a lot of people can have heartburn, or you feel full really fast. You can also see the small intestines and the colon. That has everything to do with your digestion. That's all pushed up, so it can cause some digestion problems towards the end of pregnancy especially. And you see here that this baby is head down and turning that bladder into more of a pancake type situation, so that's why you have to pee all the time. I just like to share this photo so that you can really see kind of what's going on inside your body as you are growing the baby. So as I mentioned, back pain, #1 complaint, and this is caused by different weight distribution for the baby's position. It's also caused by the ligaments that are being loosened due to hormones that are relaxing all of those ligaments in your body. So that just kind of lets everything set a little bit differently. In addition, your abdominal muscles in the front have to separate in order to allow for your expanding belly, but because of that, you lose some of your core strength and your back has to do a little bit more work. So some things that I like to talk about are comfort measures, things that you can do to help this. Definitely massage, heating pads on low, taking a warm bath. The use of a maternity belt can also help. A maternity belt is a band. It's adjustable. Generally, it's adjustable on the sides with Velcro. You can find these at maternity stores. You can also find these online. But essentially, it goes underneath the belly and it acts like a bra for your belly. So it helps hold everything up and keep everything in position to take some of the pressure off of your back. I also put this photo on here, and I think this is a good example of a pregnant woman sitting on a birthing ball. So birthing ball is just a fancy way of saying yoga ball, and you can see here how she's got her knees really wide, putting some pressure on her legs. That helps to ease some of the back pressure and take some of the weight off of the hips. So as we saw in that photo, the stomach is really pushed up into the diaphragm. The baby pushes all of that up, so it can cause a lot of heartburn. Some things that can help: you can take Tums if you're not allergic. You can eat smaller, more frequent meals. That's kind of why we feel full all the time, especially after eating a little bit. So planning your day to eat smaller, more frequent meals can help both with that full feeling, but also for heartburn. You want to watch your fatty and spicy foods, but if none of this is working, please don't hesitate to talk to one of us. We can always talk about over-the-counter medications that you can take, or even a prescription if that's something that's needed. So another thing that occurs in pregnancy is congestion, and this actually has to do with an increase in blood volume. So when you are pregnant, your blood volume expands by 45 to 50%. And all of that has to go somewhere. So it really takes effect on all of our mucous membranes. So our nose gets really stuffy, our gums start bleeding when we brush them, we have an increase in vaginal discharge. All of that is normal. Things that you can do to help with the congestion are definitely use a humidifier and saline nose spray. And also don't hesitate to ask for more advice in your appointment. Another common complaint, especially towards the end of pregnancy, is swelling. Some amount of swelling is normal. We talked about that extra fluid, and all of that blood can kind of pool in the bottom of the legs. Also, the baby's position can kind of press on some of those vessels, making that slower circulatory return very common. So what ends up happening is all of that fluid kind of pools at all of the gravity dependent spots. So our feet and our legs, sometimes even our hands, can be tight. Something to help: when you're at home, elevate your legs. So really put your feet up, because you'll notice that with rest, that swelling should go down. I also recommend drinking plenty of water, and that's really a theme in pregnancy, is the amount of water you take really affects how you feel. It sounds counterintuitive when you're having swelling and you have all of this fluid to be drinking more fluid, but it really does help. So get that 8 bottles of water a day, make sure that you're drinking, make sure that it's water, and really take care of yourself, because hydration can make all of these pregnancy symptoms a lot less severe. If you are working and you're up on your feet, you may want to consider compression stockings, because that really helps with some of the overall discomfort. Speaking of legs, it's very common to have muscle cramps, so especially in the middle of the night, you may wake up with Charlie horses. That's very common. Drinking more water can really help with that. I also find that warm water soaks also help. So 2 big complaints of pain in pregnancy, one being sciatic nerve pain and one being round ligament pain. Sciatic nerve pain, as you can see in this diagram, we have a diagram here of the sciatic nerve. It attaches in the lower back, and it travels down through the hip and the pelvis, down through the buttock, and then down the leg. Sometimes, depending on the baby's position, he or she can press up against it and cause some shooting pain in the back and all the way down the leg. It's very normal, but very uncomfortable. So some things that can help: you can try that maternity belt, because that can maybe push the baby into a slightly different position. Sometimes massage also helps. But the biggest thing is you want to try to change your position to change your baby's position. And sometimes this just means rolling over in bed. Sometimes if you're sitting or standing near a kitchen counter, you can kind of lean over that, let your belly hang. That kind of really forces the baby to kind of get in a more neutral position, maybe taking some of the pressure off your sciatic nerve. The second thing I want to talk about is round ligament pain. You may feel this all the way in your first trimester, all the way to the last. This is something that is very common. These are two ligaments that sit on either side of your uterus. They're supporting structures for the pelvis. Essentially, they start out about the size of your pinky finger and they grow to about 10 or 11 times that size in pregnancy. So as they grow and stretch, it will pull and sometimes send a sharp shooting pain on one side of the abdomen or another. Some things that can help: stretching, sometimes doing yoga makes a difference, but the real big key here is changing position slowly. So when you're in bed and you know you need to roll over, kind of do that with a little bit more slow pace than you normally would. Also, when you're going from sitting to standing, maybe do that a little bit slower so it doesn't pull on those round ligaments. So we talked about what's normal, and here are some signs and symptoms to report. So if you have any vaginal bleeding, that is something that your provider will want to know. I do want to mention that spotting after intercourse can be very normal. We talked about that increase in blood volume and how it sits in mucous membranes. The vagina is a mucous membrane, so it can kind of engorge with blood, and that is very normal. Sometimes during intercourse, it can be bumped and you can have some spotting afterwards. But if you have enough vaginal bleeding to where you're needing to use a pad, or you feel like the vaginal bleeding is a little too much, please give us a call. We're happy to walk you through what we would want you to do from there. We would also want to know about sudden, severe, sharp abdominal pain, kind of different than anything that you've ever felt before. Anything like fever, chills, flu-like symptoms, you'll want to let us know that. Also a severe headache, especially with visual changes that's not going away with Tylenol, you'll want to let us know. Any pain with urination can be a UTI, and that can actually cause contractions later on, so you want to tell us what's going on if you're having that pain. A sore reddened area on your calf, especially if it's warm to the touch, can be a sign of a blood clot, and you want to call us for that as well. So, I've talked about what's normal. So I want to kind of talk about the lead up to labor. I get asked a lot, how long will my labor be? Will it be really short? Will it be really long? What's this going to be like? And you know, there's a reason that everyone's is different. You know how everyone has a birth story, you know, from the old lady in the grocery store to your great aunt's third cousin. Everyone has a birth story, and everyone's is different. You hear labors that are minutes long, and you hear labors that are days long. And that's because every mom, every baby is different, but there's also some factors that come into play that influence labor. And these are called the 5 Ps. So I'm going to break those down. The first P is called passenger. Passenger is a fancy word for saying your baby. Your baby's position and size have everything to do with labor. As you see in these two pictures, this one, it says occiput anterior. This is the favorable desired position for labor and delivery. You see here that the back of the baby's skull is pointed towards the pubic bone and the baby is face down towards the mother's bottom. That actually makes for a shorter, easier labor because the baby's already in a good position for descent into the pelvis. On the other hand, then you may have babies that settle into an occiput posterior position, and that's when the hard part of the baby's skull is facing towards the mother's back and the baby's kind of looking up towards the mother's pubic bone. We call these babies sunny side up babies, and it's absolutely possible to have a healthy vaginal delivery with an occiput posterior baby, but sometimes it can take a little bit longer because the baby has more maneuvering to do. Also, the baby's size can really make an effect on the length of labor. That's why we constantly check your measurement at the office, making sure that you're growing appropriately and watching the baby's size. So that's the first P. The second P is called passageway. Why they didn't just call it pelvis, I don't know, but they chose passageway. Essentially, it's all of the structures within the pelvis that can make a difference on the length of labor. We're looking at the pelvic bones, which I've shown here. We're looking at the shape of the bones and how they come together. We're looking at the cervix, which is the opening to the womb. And we're also looking at the vaginal tissues and vaginal muscles. All of that can have an impact on how easy labor is and how quickly it can occur. That third P is called position. So position is actually something that we have control over. You know, the last two P's we really didn't. You know, passenger and passageway, we don't have control over those things, but position is something that we do have control over. It has been shown time and time again that mothers who are able to move around and be upright tend to have shorter labors than moms who cannot be upright. And this is simply explained by gravity. So gravity, we want to use that to our advantage. So when you're in labor, especially that early part of labor, we will really encourage you to stand up, to move around, to walk back and forth, to sway on the side of the bed. All of those positions really help to open up your hips and allow the baby to come down naturally. Now, later on, if you have an epidural and you need to be in bed, the nurses and your provider will get you in a ton of different positions to help the baby come down and to keep those hips nice and open for delivery. So that fourth P we're looking at is powers. So with powers, sometimes we don't have control over this and sometimes we do. We're really looking at the force of the contractions. So in order to have a baby, our contractions need to be pretty strong. In the beginning of your labor, they'll be mild, but slowly they will build in intensity until the end, and they're really intense. We need those strong contractions in order to help the baby push down and out. Sometimes, if contractions aren't strong enough, we may need to do things to get them stronger. For example, we may get you up and moving, get you in a different position. Sometimes we need to use medications, but I'll go over that in the second part. The next thing that we look at is the pushing ability. So when it's time to push this baby out, we really want to focus on, is the mom pushing correctly? Is she pushing with the right muscles? Is she making progress? Those two things are encompassed with the powers, and that can really make a difference on the length of labor and delivery. And this last P is something that I don't think gets enough attention, but it's the psychosocial environment that the mother is in. Is she doing okay? Is she feeling supported in labor? Is she tolerating labor okay? Is she doing her proper breathing exercises if she's going through this labor naturally? That really does make a difference on the mother's overall perception of how her labor goes. You can have a really long and difficult labor, but if a mother feels supported by both her partner and her care team, it makes for a smoother experience that a mom can look back with fond memories. So definitely this part cannot be overstated. It's really important and something that we strongly encourage. So I've gone over pretty much everything about the end of pregnancy. I talked about the things that can influence labor. In that next part, we're going to go all over labor and delivery. I'll talk about the stages of labor. I'll also talk about natural deliveries, pain medication, epidurals. We'll talk about delivery and what happens at that point. So catch me with that. Come on back, and thanks so much.